This side of global health, I'm on the other side, working as a doctor in a remote part of Kenya, where the median age of the first birth is about 17 years old. So a lot of the time, I'm counseling young Samburu men, trying to get their consent, so that they can give me consent to perform C-sections on underage Samburu women who happen to be their wives. So the question is, a lot of interventions have been done, but still a quarter of people between 15 and 19 are in childbearing age in this part of Kenya. How can we engage these young Samburu people so that as we give them access to universal health coverage, which for them means not getting pregnant before they're 18, how can we engage them? How can we sit on the tables? How can we talk to 13 and 14-year-old Samburu men and women so that they too are part of the solution of ending teenage pregnancy in that region? And that's just one of the examples of how we need to engage young people at the core level and ensure that they are sitting on the table. So to start off this session, we are very privileged to have Dr. Matsidiso Moeti, who's going to give us some remarks. We all know her as the regional director, but I took time to find out that over her long career in public service, she has worked with issues that touch on young people. She's worked in UNICEF, she's worked in UNAIDS, and she's worked on the NCD agenda, all issues that touch on young people, and maybe that's why she's so passionate about health for young people. Today morning, she talked about the transformation agenda, the transformative agenda of WHO Afro, and broadening the partnership to include young people. She also talked about us young people as critical new partners, and indeed she has walked the talk. Earlier today she was on Facebook talking to young people, even as a regional director of Afro. And earlier in Nairobi this year, she spent half an hour of her time answering questions from young people. So this session is a continuation of her walking the talk and really engaging young people as we try and achieve universal health coverage in the region. With your permission, Sidi, welcome to the stage.
Thank you very much. Honorable ministers, heads of delegation, representatives of ministers and members of government, our colleagues from other UN agencies, UNICEF and UNFPA, with whom we're working on the issue of young people and health, young people who are here among us, ladies and gentlemen. I'd like to welcome all the panelists and welcome you as well to this side event, especially the young people who will also be taking part in this event through the social media and through your online questions. So I enjoyed earlier on a few minutes with some young people who asked me some really sharp questions. So they're on the ball. We need to step up in order to be able to respond to them and respond to their health issues. So our continent, Africa, is a continent with the world's youngest population, 70% under the age of 30. And this presents us with a huge opportunity to harness their potential, as I said this morning. The health and development of Africa's youth are key to our achievement of the Sustainable Development Goals related to health and those that go beyond on the African continent. For us in WHO, youth are a critical new partner. They are key stakeholders we consider in health development. These are Africa's future leaders, and we've seen their leadership demonstrated. And they need to be at the table. They need to be there when we're making decisions, when we're looking at data, when we're reviewing progress and gaps, and when we're talking about how to cover them. We also know that what we are trying to do in WHO is aligned to our resolution to promote the participation, empowerment of young people as key stakeholders in health development, including in the work of our organization. So we are looking for the ideas, suggestions of the young people, medical students, young doctors, young researchers, other people in other sectors with knowledge and expertise that is relevant to health development on the continent. We're also building on the momentum of the recent African Union Summit in January, whose theme was harnessing the demographic dividend through investments in youth. We're particularly keen to engage young women, young girls, and also to take part in the process of empowering women, involving them in shaping public policy. And I think the story that you just told just is so illustrative of the need for this. We'd like to facilitate young people to play leading roles as key actors, as I said, in planning, in decision-making, and in implementation. In our quest to have universal health coverage, we think that if a health system is delivering for young people, that often forgotten group who only get considered when we think about pregnancy and HIV risk, but who have many other health problems and who have so much potential to contribute to health now and in the future, then I think we really are missing the boat. Young people have other health problems. Of course, they have problems accessing sexual and reproductive health services, including sometimes in making decisions on when to engage in sexual relations. But they also are the biggest victims of violence, of injuries. They have significant mental health problems. And we know that if our young people live healthy lifestyles, we'll save trillions in terms of NCD management and treatment. I'd just like to tell a story about one example of engaging young people, which I found absolutely fascinating. The First Lady of Namibia has taken it upon herself to champion the health of young people in her country. And she organizes sessions of dialogue with young people, not in beautiful conference halls like this, but she follows them to the nightclubs in Windhoek where they hang out, and not high-class nightclubs either. So she related to me how she invites to these events some young people, older people, the police, people from health. She goes to the prisons and in her dialogue with young people has spoken to some young men who have been imprisoned for raping young women and has tried to understand what is going on in the life of a young person when this happens. We can ask young people whose lives are influenced in other ways to be not so healthy, their stories. We can ask many young girls what are their stories. And then we can harness their views, their experiences, their advice, which can lead us to work in very unusual ways to make sure that they inform our policies and that we shape and design our healthcare systems to deliver for young people. So welcome to this session, and I look forward to a very interesting discussion. Thank you.
Thank you very much, Dr. Mweti. Because this is a youth side event, there are a few new youth rules. You are all encouraged to tweet. So if you haven't been looking, the screens will give you the hashtag. If each of you leave with one tweet, that means there'll be 1,000 tweets tonight, where young people won't only know about the latest music, but they'll also know about their health. So the health of young people and what they see today on social media is in your hands. And with that, I'd like to move to the panel. I'd like to introduce the panel. We have Dr. Gitahi, who's a group CEO of AMREF, and who's a big champion for young people. We have Dr. Okebukola, who's the McKinsey and Partnership Associate Principal Company, leading in the healthcare work in Nigeria and West Africa, and a young African. We also have Ms. Mambodo, who is a lawyer by profession, currently working in GSK, where she heads the ethics and compliance function in the GSK business in Africa. But today she's here in her personal capacity because she's spoken a lot about engaging young people. And she does have a YouTube video that has more than 100,000 views, and I really would encourage you to look at it. And finally, we have Dr. Magnifique Irakoze, a young Rwandese who is a regional coordinator for the International Federation of Medical Students Association. So in many ways, the future health workers of Africa are his responsibility for the moment. So maybe we can start with Dr. Gitahi. As someone who leads a regional organization and is trying to ensure that we achieve UHC, how can the engagement of young African professionals be mainstreamed? How can it be part of the conversations, and how can it be part of the policies of the things that affect them?
Thank you very much. I think first I note that myself and the regional director have significantly increased the average age on this table. So the next thing I would like to say is, recently we had the Africa Health Agenda International Conference in Nairobi, which we hosted with WHO. And for that conference to happen, before that, we held what we call the conference, which was the youth, and we had over 200 youth there from different countries, about 11 countries. Dr. Arugoro was one of the people there, one of the organizers. And when the youth came out of that conference, they shared a communique whose parting shot was, nothing for us without us. And that actually, for us as AMREF Health Africa, gives us the platform on which to look at this youth issue. I think for me, the most important thing is that the participation of the youth in the UHC and in other matters is not a participation of side discussions. It's a participation of being right there on the table, being involved from the beginning to the end. If we say that the biggest shareholders of our continent is the youth, 70% under 30, our median age is 19, then we must actually start to think about how they will take over the next agenda. And even in the morning as we were discussing health financing, which is a core pillar of achieving universal health coverage, through my mind was going the issue of how do the youth get involved in this? And for me, the way to involve the youth in UHC is, number one, to have them engaged in generating the evidence that is needed to identify what are youth-relevant responses to our healthcare. So they need to get involved in research, in participation, not through some meetings, but being actively involved in the ecosystem. The next thing is, once they have that evidence, I think the biggest power we have with the youth is to train them as advocates, not advocates for activism on the streets, but advocates for participating in budget preparation and participating in accountability. I think more recently, if I was to, I tend to be sometimes controversial. If the Tanzania government is here, please do excuse me. Recently, we had the president of Tanzania say that girls who get pregnant and are in school will not go back to school. Now, we, as AMREF Health Africa or WHO, cannot question the president of Tanzania. But the people who can question the president of Tanzania are the people of Tanzania. It's the youth of Tanzania who can go and say, we need to come and have a conversation with you. But for them to be able to do that, they need to be trained, they need to be provided with the necessary evidence, the necessary data to have that conversation. So I think the biggest area for the youth to be engaged in UHC is to understand the evidence, then to be trained to be good participants in budget making, in policy making, and finally, to be good participants in holding governments accountable. And finally, is for them, within this evidence, to also start to generate innovations, and not innovations for the sake of innovations, but participating and coming on the table to many of the organizations that we run and say, I have this idea and I would like to be embedded in the organization to test it, so that they're not testing it outside the normal existing system, because then when they test it within the system, there is a better opportunity for survival. So for me, maybe just one last story before you move on, Waruguru, is, there's a small girl that I've met in some rural area in Kenya. She is 11 years old. She's escaped female genital mutilation. And this girl was, she was supposed to undergo female circumcision when she was about 9 years. And she managed to convince her parents not to take her through that process. Now she's in school. She's a big advocate. She talks to other girls. She talks to the elders. And she still goes to school. Now that's what we are talking about, the youth participation. It's not for them to leave the mainline development. It's for them to participate in UHC as they also go through the normal youth development cycle. So those would be my remarks.
Thank you very much, Dr. Gitahi. And I'll come back to you about innovation and how we can scale it up. Maybe next we can move to Dr. Okebukola. You've worked in private sector, you've worked with multilateral partners, and as a young African, you've been able to work professionally and build your capacity professionally so that you're part of the decision makers. So to the young Africans who are joining us online and who are here, how would you suggest that we can build capacity so that young Africans can engage in health on a professional level? What advice do you have for them?
Thank you. Thank you so much. I have 3 key messages. But before I give the message, I want to just, with your permission, do a quick survey in the room. So if you would just oblige me, 2 criteria. 1, if you're under the age of 45 years of age. And 2, if you ever held any position of authority before you were 45, as assuming you are above 45. Can I have you stand up for a second, please? So if you're less than 45, or you ever held a post of authority before you were 45, and you're in this room, Can I just see you stand quickly? Yes, we can also stand as well.
I'm not that age.
So am I assuming that people who are sitting down are all above 45? Are you all above 45? No? Okay, great. Please have your seats. Thank you. So I think you get my message. My message is this concept of youth seems very far-fetched, but you're actually referring to all of us in this room, in my opinion. And so our discussion today needs to be anchored on the fact that we are not talking about a hypothetical group of people who need to be empowered. We are talking about the bulk of us living on this continent on a daily basis. So having said that, my quick message is to you all today. The first thing is, without this group of people, there's nothing that can be done. We are the catalysts, we are the accelerators of progress on this continent, and even beyond the continent. I mean, you can all think of names of young people who have dramatically transformed how we live our lives. We are on Facebook right now. The person who started Facebook is one of us. You have Uber, you have all these transformative organizations led by people who we categorize as the youth, right? So we need to move forward with this engine and dramatically accelerate our progress towards universal health coverage. That's my first point. My second point is we need to take ownership of our engagement model. Before I came on this panel, I engaged a couple of colleagues in the audience and asked them, I'm going to be on this panel. What would you like me to share? I can see some of them already smiling in the back. And the point they made was, we need to be the drivers and not be driven. And so I encourage every young person who is listening to me right now, if you're in school, if you are just finishing school, take ownership of your engagement, right? We need you to drive the process and help us take this dream of universal health coverage, to the future we desire, right? My third point, and this speaks to your question directly, Wariguru. If I think about how we can improve the capacity of young professionals to really engage, I think about it across 4 dimensions. And on this one, I'm going to be a bit, contrarian, a couple of thoughts here. The first one I'll say is with regards to policy making, right? There's so many interesting, white papers that have been written to try to encourage youth participation in policy making. However, the important thing is, both from a global level to a regional level, national and sub-national levels, we need to have a more concerted effort to engage youths in policy making. One challenge I'll give is to the WHO itself, and thankfully Chidi's here. There's nothing wrong with WHO becoming a leadership factory for young people in Africa. I know the World Bank started this young professionals program, but you need to think about a program similar to that in WHO, where you bring all the young people together, give them 6 to 9 months of really high intense capacity building, and they can transform our society. So that's one challenge to the WHO. The other thing I'll say is, companies like mine, McKinsey, I was part of the team that started what we call the Young Leaders Program across multiple countries in Africa. So Nigeria, Kenya, South Africa, where you take young people who just finished, basic, BSc or college, and give them a 2-year period of intensive training for consulting, for industry, for other parts of the economy, and then leverage those skill sets to transform the economy. The same can be done in health. We're doing so in healthcare, right? The other piece is around service delivery. We all know that, like we discussed this morning, primary health care is central to the conversation. And primary health care starts in the communities. A lot of our community-based health workers, CHWs, CHEWs, corps, there's so many names for them. They are predominantly youth. And so one way we can really try to help them is to build their capacity at that level to do community engagement, mobilization, advocacy, and all of those strong things at that level, right? Finally, if I think about professional training, we have a lot of our colleagues who are studying medicine, pharmacy, nursing. Someone made a point in the previous panel that we are producing more than we can absorb. I respectfully disagree with that. Right? I think we are not producing enough. That's why our ratios are really poor across the continent. But the most important thing here is those that we produce, let us continue to train them further to become peers with their colleagues wherever they are, nationwide or worldwide. Now, I want to end on this note. Social media has transformed how we live our lives today. Most so-called young people spend more time on social media than even having a conversation with their friends. How do we deploy this tool to really drive universal healthcare coverage? I mean, we can have that conversation later, but that's an interesting piece I would love to explore in further conversations. Thank you so much.
Thank you very much, Dr. Okebukola. And so he's given us the challenge which I had given again, and I'll keep on reiterating. On the screen are hashtags. Please put out your phones. Please tweet so that the young people who are not in this room can be part of the conversation, because health will only become part of the conversation as much as we put it out there. So we'll move on to Ms. Mambodo. You have been working very hard to ensure and talk about the role of young women and how they can get a seat on the table. To give an easy statistic, Dr. Mweti is the first woman regional director of Africa, 70 years, almost 70 years later.
That merits applause, doesn't it? It does. We're making strides.
And to add another statistic, even though women make up 80% of the health workforce, they only make up 25% of health leadership. And so I think it's very critical as we discuss young people and them getting involved in universal health coverage. We also discuss how we can engage young women so that they can be active voices in the decision-making process. What are your thoughts towards that?
Well, I think we have to approach it in the very same way any really good organization would when it makes important decisions. What is the first thing that they do? Stakeholder mapping. What we've said is, and what we know, is our continent is over 50% female. So if we are ever going to achieve our dream of universal health care, we need to understand the fact that women actually are fundamental drivers and key stakeholders in ensuring that we achieve that mission. But there's something layered underneath that, because when we say women are a stakeholder as a group, we're making that monolithic. So let me get down to some granularity here, because I want to propose 5 ways in which we can actually break down that monolithic group and start to engage women on multiple levels. So the first group of women as stakeholders is women as patients. We're all here in this room today because there are patients. If there was no disease, there would be no patients. If there were no patients, we won't be here discussing how to eradicate disease. So if we are going to actually engage in universal healthcare coverage and achieve that, we need to be interfacing with women as patients on the one hand, okay? The other way we need to be engaging young women across this continent is women as caregiver. Now, I'm looking around the room and I know that many of you recognize what I'm talking about, but I will tell you one of the pleasures and greatest privileges I have had in my current job is traveling across the continent to see how healthcare is being delivered and how my company's drugs are being administered. And one of the things I do is I sit in waiting rooms in public hospitals, private hospitals, watching patients who are waiting to get appointments with doctors. And I can tell you that from Accra to Abidjan, Antananarivo to Luanda, Douala to Yaoundé, Nairobi to Windhoek, I see the exact same thing again and again. And what is that? Every single patient who walks in there walks in with someone who's caring for them. 9 out of 10 times, that person is a woman. It could be a mother, it could be a sister, it could be a grandmother, it could be every single one of the women I'm looking at across this room right now. So when we start to engage in talks about universal healthcare coverage, why aren't we talking to women as caregivers, right? So we might engage them to some extent as patients, but there's this invisible group of caregivers which we're surrounded by. When we think about women as caregivers, we think about the people who sit at our bedside when we're sick. When we go home to recover, they're the ones who are usually ensuring that we're following the regimen prescribed by doctors. They're the ones ensuring that they're reporting adverse events from medication. So when we talk about effective delivery of universal healthcare coverage, we need to be looking at the woman as caregiver and inviting her into the conversation. The third group I'll refer to are are frontline community healthcare workers who on our continent are predominantly female. You've heard from different panels today the importance of having frontline healthcare workers, particularly in rural areas and poorer urban areas. Now, why is this relevant? For multiple reasons, but I'll focus on one. I heard somebody ask a question earlier on about how do we bridge the gap between cultural or social mores that prevent people from seeking scientific help and allow them to relegate to using traditional medicine as we know it to cure disease. The question for me is, we have community workers living in communities who do this. How have we engaged them to help us understand the culture of those communities and why it is that in some of our communities in 2017, some women still prefer to give birth at home rather than going into a hospital? If we are actually going to achieve a dream of universal healthcare coverage, and it's a key part of that, ensuring that we're protecting mother and child, we need to be able to rely on the knowledge and the trust that our predominantly female community health workers have built within their communities and leverage that information to bridge the gap between scientific institutions and our more remote areas and poorer urban areas. The fourth area I want to talk about really quickly are women as healthcare providers. We know the vast majority of doctors are men, the vast majority of nurses are women. But what I want to talk about in terms of how we engage female healthcare providers, wholly separate from health workers, is in the area of research. We just had a really hot button panel about this question. But what I want to highlight really quickly, but it's an important point, is we know this. Diseases tend to manifest in men and women very differently. But it was not until about 20 years ago that the United States, through the NIH, started asking the question about, when we conduct clinical trials, are we actually checking for symptoms in men and women in different ways, as opposed to assuming that symptoms in men manifest the same way in women? And I recently watched a TEDx talk by Dr. Paula Johnson, a surgeon in the United States, called His and Hers Health. And the point she was making was around lung disease as well as heart disease. And she said America had been losing many female heart disease patients because they were losing the fundamental fact that while women's symptoms of heart disease manifested very differently from males, they continued to use the gold standard based on men to try to diagnose heart disease in women. We need to change that, and we need more female voices as healthcare providers to help us detect disease and treat them. The final area I want to talk about, which is really, really near and dear to my heart, is the area of women as policymakers. We just heard about our first director here, Chidi, and policy. If you think about the number of ministries of health that we have across Africa and the number of women who are heading those relative to men, it's a very low number. However, the most important health decisions, including universal health care coverage, tend to impact more men than women on this continent because, as we said, there are more women than men on the African continent. But looking at universal health care coverage in particular, the one question that sticks in my mind is, who gets to define what disease is? And who gets to define what a health issue is? And to illustrate that point, Chidi, earlier on today you talked about menstruation. And I'm going to use the word menstruation and not the word period intentionally because we have to shake off our discomfort around using that word, yeah? One of the things that we talk about with SDG 5 is maternal care or women's reproductive health. But rarely do we talk about women's reproductive health in the context of menstruation and ensuring that we are destigmatizing the kind of stigma that comes with young girls and their periods, right, or with menstruation. So I will ask, as we leave here today, to reflect on that point. If we do not have enough female policymakers, or if we have female policymakers who we do not engage, who gets to define what is a woman's health issue? And if women are not having that conversation, who are we missing? And unfortunately, I think up to this point, we have been missing menstruation as one of those key areas, and we need to look at that. And to your point about relying on social media, I will ask you, as we move on to my colleague here to the left, please feel free to hashtag menstruation is not a taboo. Young girls need to hear that. I've tweeted it, so if you don't want to tweet it, find me on Twitter and retweet my tweet. Menstruation, let me recite it. Hashtag menstruation is not a taboo. Young girls need to hear that. We need to be advocates of that. So I'll end there and say, let's think about these 5 ways in which we can continue to engage women as stakeholders in the larger dialogue around the delivery of universal health care.
Thank you very much for your insights. And so as you hashtag, and I will check who's tweeting and maybe mention a few people in this room, we move on to Magnifique. Magnifique, as a regional coordinator of Africa, and as the one kind of responsible for the future health workers of Africa in this moment, how can young people hold ministers and policymakers to account in terms of the health that will affect them and the health systems that they will take over in the next few years?
Thank you so much. Actually, for your information, the position I have right now, Dr. Walugul was like the region director for Africa in the International Federation of Medical Student Associations. So you can actually imagine how we are getting involved as youth. So that is actually a very important question. How we young people can hold accountable the governments to ensure the health and health systems are working. I will actually twist a little bit the question and go through a story. I come from a country where we are sitting right now. This country actually has a very different story. When you go back 23 years ago, the youth were not involved and were used. And when a youth is used and not involved, what can do is actually a tragedy. So the youth contributed out of 99% to destroy this country because they were just not involved, not engaged, but used. And when a youth is actually used, can do a lot out of his mind. But when a youth is involved, can actually participate and own everything. So as the youth across the continent, we need to be engaged. They should stop using the youth. We do not want tokenism. We want to be part of the decision making. We want our voice to be heard. Thank you. And I think when we are actually involved, we'll be able to get our continent to the next level. But this moment of just using the young people, it's not going to help us anymore. I will actually comment on some initiatives of the youth. I quote the organization I'm now representing here, IFMSA, International Federation of Medical Student Associations, together with the pharmacists and other health student associations. We're going to host, we came together as one body because we think when we unite ourselves as young people, we can actually have a bigger voice. And now we are hosting all the healthcare students in Africa, in this country, in November. And this is actually something that youth are championing, and it actually worked, you know. I can also quote something from us here in Rwanda. The youth, some people actually have been talking about the community health insurance we have here in Rwanda. It can actually not be a success without the work of the youth. Because we, the youth, we are the ones that are going out there in the community, sensitizing the community to have the insurance. Tell them that, hey, my father, my family, if you don't have this, we can't go anywhere. Your health is not insured. So we, the young people, we are the ones that can drive changes. If we are not engaged, if we are not where the decisions are being made, we are just going to be used. And remember, as I told you, our story, if we are used, we can be so dangerous. So engage us, and we are going to help you and to help everyone to move this strategy. Thank you.
Thank you very much, Magnifique. I think that deserves a round of applause. It seems this panel is all about challenges. Magnifique is challenging the decision makers to involve youth constructively and ensure that that energy is put to good use, maybe to make some very good solutions for the region and bring about universal health coverage. I'd like to go back to another challenge that was posed to WHO. Is WHO ready to be the leadership factory? Dr. Okebukola asked that. So maybe I'll throw that to Dr. Moeti. Are you ready to manufacture leaders?
I guess I could answer you in one word, yes. But just to say that, of course, we'll have to learn what is the best way to engage in this so that we do indeed help to produce those young leaders. We're ready to take on this challenge in WHO. In terms of involving young people in our own recruitment now, if you look at the average age, and I'll tell you, I'm the oldest person in WHO in Africa because normally I should have retired. But if I wasn't the regional director, I'd be gone. But we tend to be quite a middle-aged population because we recruit well experienced. We indicate the number of years that you need to have before you can get a WHO position. But we've recognized that we are enriched when we open up that space and we bring on board some young people. And I think you've seen a couple of them walking around here. So we are starting to walk that talk, and we are looking for other ways. We talked about supporting young researchers. We're looking for young interns, looking for young professionals. So in addition to our advocacy, our engagement with young people in terms of the role that we can help them to play, even facilitate their engagement at country level. We have here a number of WHO representatives. I'm sure they are hearing what we're saying. So my expectation is that when they go back home, they look at this initiative and they'll see how to work with ministers and officials in the countries in order to make space for young people so that we benefit both in WHO and in the countries from their knowledge and energy. Thanks.
Thank you for taking the challenge and throwing that challenge to your WRs to have young people in their offices. I hope the ones who are here are listening. It is on YouTube and live. And I'd like to move on to something else and talk about innovation. Today, the Honorable Minister of Uganda talked about a sickle cell innovation that uses a mobile phone app and a clear application and a small lens, and they're able to see sickle cell. And this question goes to Dr. Gitahi. This innovation is in Uganda and is called MDEX and is at a very primary level. However, in countries like Gabon and Cameroon, we have 20 to 30% of sickle cell. How do we scale that up? How do we take that very good innovation that makes healthcare more accessible and more affordable from young girls to Uganda, to Gabon, Cameroon, to places where it can be used?
Thank you, Argo. The first thing I would like to say is really appreciate the comments from my panelists, the fellow panelists here on how to engage the youth. I'm learning a lot from just you guys speaking here. The next thing to say is that the issue of youth, to my understanding, is an issue of both, it's an issue of equity, not equality. I think the way we have approached the youth issue is, if you can come to the table, please find us there. But if you can't, you don't have 15 years of experience or 10 or whatever, it's fine, we'll meet you ahead. I think it's time to change this dialogue to equity, to say it's about giving the youth an advantage platform so that they can come on the table. I think that is very important for organizations like ourselves and others to realize that there are times when you'll bring the youth on board because you have purpose to do so, not because they meet the relevant experience. And I think that's something that we need to pick up. On the issue of innovation, I've worked a lot now with young people on innovation. And we recently held like a hackathon for maternal and child health. And we had a lot of youth participating. We had youth from Nigeria, Uganda, Kenya, Tanzania. And I think the challenge that I saw is that a lot of these young people are working on innovation without being provided the platform or the ecosystem on which to develop the innovation. If you find a lot of the youth believe now that once you have a brilliant idea, like Zuckerberg and like the other guys of, Uber and the others, you will succeed. But entrepreneurship requires management and leadership skills. It doesn't exist in a vacuum. The fact that the youth are very innovative, they need to be provided also the ecosystem that starts to see all the other variables in making entrepreneurship a success. So for us at Amref Health Africa now, we are starting to do what we call innovators in residence. So we find people like those people in Uganda, and we say, we have an interest in sickle cell, so come on board. We have a program or two, this is funded by this organization and this other. Work within that program, work with the project managers, we'll pay you a stipend, but work, don't just test just work and see how the system works. As you do that, test the innovation. Eventually, scale requires that you identify how to complete the market-driven loop. Scale requires that any innovation can complete the loop of costs and revenue. I think that is the challenge, that when you create an innovation and you just leave it there, it doesn't work on its own. You need to complete that loop. Now, how do you complete the loop? You need people to invest in it so that they can open the market, you get customers, and then the customers pay for it. And those customers don't have to be necessarily the women that she was talking about. They could be government. Public procurement is huge in catalyzing innovations like this. But how do the youth access public procurement if they are not within the existing ecosystem? Like WHO, the World, Amref Health Africa, and other organizations. So for us now, we are coming on board and saying, these innovations, come on board, let us now work together. We have actually recently launched what we are calling the Innovate for Life Fund as Amref Health Africa, and this is a fund to catalyze investments into innovations that we bring on board to Amref. And eventually, we may have an equity share, we may just have a profit share, but we have to complete the revenue loop for the rate to be sustainable and to move forward. And we're offering the youth that opportunity.
Thank you so much for sharing that example with us. I think that is one of the ways we can cure the pilotitis that was being talked about earlier today at the side event for eHealth. And with that, I'd like to take up questions, both from the audience and online. So as I wait to get the online questions, are there any questions from the audience? I will say something. I will have a bias for young people. So even if you're young at heart, you're welcome to put up your hand, but I will have a bias for young people. So maybe we can start with the lady at the back who's waving. Thank you. Please tell us your name, where you're from, and kindly keep your questions short. That mic is not working, so as we get that mic to work, we'll take a question from the other lady at the back in black.
It's working.
Okay, it's now working.
Thank you
Please
so
keep your
much.
question
My
short.
name's Flavia Mutamutega. I'm working from Girl Effect Rwanda. Our main focus are adolescent girls. So I'm so happy to be in this forum. Some panelists talked about menstruation. So my reflection came to the person earlier on who gave us two stories. One of a girl well off with access to phone, another with nothing at all. Now, we are asked to tweet and give the message that menstruation is not a taboo. That message for me is targeting that one who has no access to the phone. My call now in this forum is, how do we make sure even those who don't have access to phones get access to those messages from the social media? It's an important thing. And today with technology, I think we cannot afford to miss any because she cannot have access to tools or devices. My second contribution will not be a question.
I'll ask you to keep it short.
Yes, very short. To the young leader, representative of youth, I agreed that you don't have to be manipulated tokenism. Take the action, say no, start today. Thank you.
Thank you very much for your contribution. So we'll take a question from the lady in black who's standing.
Hello, I'm actually a social entrepreneur, so I love everything that you guys are saying up there. I really thank you. One of the things that I wanted to ask is, how are you ensuring interdisciplinary groups and sort of backgrounds in these groups? My background was in international education. I'm now doing assistive technology for kids with disabilities, and my team is all engineers. So I'm just wondering how you're making sure that that's happening in the hackathons that you're doing here through all these youth, and how are you making sure that these youth know that they can be a part of it?
Thank you. I'll take one last question. I'm looking for the youngest person with their hand up. Someone is waving, so I hope you're young because I can't see you. I've taken two women, so I'll take a man. Yeah, you next to the microphone.
Good morning. My name is Dr. Boyiga Bodinga Noga, BBN. I'm from Nigeria. I'm the co-founder of an organization called AB Global Health Initiative. 3 years ago, I happened to meet a man called Don And he's the reason why we have at least 45% of youths here today. He's by my right-hand side. This man has been doing a lot of work in Africa by trying to help young people grow up in global health. Now, I want to challenge all our leaders here today. If I hadn't met this man, if I didn't meet him 3 years ago, I would not be here. So I want to make a challenge. Instead of procrastinating, we have youths here today. Can you start building us up so that we can make the change Africa needs today? Thank you very much.
Thank you very much. Unfortunately, we've run out of time. So, as I promised, I will recognize one person who has tweeted, "Menstruation is not a taboo." Itai Josh Rusike, where are you? Thank you. I just wanted to acknowledge that there's someone who's carrying forward this conversation. He's very excited to be mentioned. And that's important because today there's someone who hears menstruation is not a taboo. And this conversation moves beyond these beautiful walls to young people on social media. And so maybe we can take up the questions that have been asked as we wrap up the panel. The first one was, how do we make sure we speak beyond social media? Because while there are young people on social media, not all young people are on social media. Maybe I'll give that one to Irakoze, Magnifique. The second question is, how are we ensuring interdisciplinary groups? Maybe Dr. Okebukola, you can tell us, as someone who works in interdisciplinary groups, is the health sector ensuring interdisciplinary groups? And lastly, it was more a challenge to all of us here, how pick up a young person. So as you leave today, this is the last challenge of the day. There'll be no more challenges for anyone. Pick up a young person you see, engage them in a conversation. You may give them mentorship, you may give them a good idea, you may give them a connection that would move forward their career just as it did for the gentleman who stood. So as those two questions are answered, we'll close the panel. But this is a youth panel, so essentially the panel is not closed. The conversation continues online. So please continue tweeting, and thank you for your attention as we finished. So Magnifique.
Thank you very much. I will actually answer with a controversial answer to that question. First of all, if the world is looking at the youth, actually some of the youth are marginalized because they are in rural areas, because they can't access the tweets and stuff. It's because we are not looking at the education. Because I believe, like, if someone is well educated, he will think that, she or he will think that he needs to know what is Twitter and what is Facebook and how does it work. So if we are still having so many young people who are out there in the community who can't access those available tools, we actually have to think twice. But what is happening in my country, we already have access to those information via phone without even like having a smartphone. So the government has put up a free line whereby any person that wants to get any information regarding the reproductive health can just get a free number. They don't need to have any money to pay for that service, and then they can get informations and they can actually get help that they need. The other thing that was put up by our Ministry of Health is the youth-friendly services. And those youth-friendly services serves as a place whereby the young people are free to talk about anything they want, be it menstruation periods, be it anything they want regarding the reproductive health informations. So I see it as a tool that we are using in our country to help the young people to get the information they want. But let's focus on how to make sure that those young people who cannot access information through the available platforms, they can also be there. Because I'm not sure that they are going to challenge these, they are not going to be involved if they are still waiting the information that are going to get them in the village out there. They need to get education and get to use all those available tools. Thank you.
Thank you. And you gave another challenge after they said there'll be no more challenges. So a challenge to ensure that education is spread out because it is a key to health and universal health coverage. Dr. Okebukola.
Okay, thank you. So I'm sure Githinji can add to this as well based on your hackathon experience. But it's a really good question, and it underscores a lot of the narrative around intersectoral collaboration that we talk about very often. Specifically to your question about new businesses and getting folks involved outside the health sector, it's something that we have quite a lot of experience with, right? I'll give you just 3 quick examples. First one is around, we started in Nigeria something called the Private Sector Healthcare Alliance. And it's basically a pool of funds from the largest conglomerates in the country focused on healthcare. And part of those funds are set aside for what they call the Healthcare Innovation Challenge. So a lot of young people come up with wonderful ideas, and you basically incubate those ideas with them. Very similar to the Y Combinator you have in Silicon Valley, right? And getting folks from diverse backgrounds, engineering, communications, all of those really help strengthen the businesses. And I'm sure it's very similar to what you found in your place as well. The other thing that we do is what we call, pro bono business connects for small businesses, right? And once again, just getting those ideas to flow in and getting creativity from a lot of people who don't think like we do, right? It really helps to strengthen the answer, in addition to all the other hackathons and things like that. So maybe you want to just also share some light very quickly on what you found. Sorry, with your permission, I want to hear what he has to say on this one.
Actually, very quick. I think my experience is that actually is quite the opposite. A lot of the people we find in the healthcare innovation space are not people in the healthcare space. They are actually people from education, they are people from engineering. When we had the hackathon, we had 50 people for 48 hours. There was only one clinician, 49 were not actually in the medical space. And they were all discussing, so what do we do? They were used to designing innovations for transport. They were designing innovations for supply chain. But now we had given them a challenge in healthcare. And we had even to put resources like public health people, some of our program managers, doctors, in the room so that they could ask, so when you talk about postpartum hemorrhage, what is that? And then they would explain. So I think your point is relevant. Healthcare innovation is not going to come from healthcare practitioners. Actually, it's actually going to come largely from elsewhere, but then the healthcare professionals have to embrace it and then guide the discussion. So that's my experience. Yeah.
Thank you very much. I know we had said that's the last question, but we do have an online audience. We had really requested them to ask questions. So in order to honor our online audience, and thank you so much for joining us, I'd like to ask just one question. And as rightly so, I'd like to direct it to Dr. Mweti, and with this we'll finish the panel. The question is from Kiddie World via Twitter. They ask, time and time again, it seems we rely on developed world data, or data not from the region, to feed us their data concerning medicine. What about our data? How can we generate more data? How can we use more data? And to tie into this panel, how can we use young people to generate this data? Very short, if you may.
Tough question. I mean, I think that already we have data systems in health in countries, the normal health information system data that are quite weak. Although it was said earlier today that we have a lot of data that we are not exploiting, that we are using. And we have a lot of young researchers who are collecting data. We've got a lot of people, a medical student challenged us here to ask him the question, why is it that they do research, they generate data, and he somehow has the impression it's not used. So I think we can engage young people who are professionals, and we can engage young people also who are interested in health as those who can provide information. So I won't call them subjects, but so we can engage people in different ways, in focus groups, in groups where they gather. This is how we can work with them to collect data, I think. So within existing systems, within the areas where they congregate. So I would turn it around to young people. Where is it that you think you have information, you have ideas, and how can that be captured? Partly as data, so that it can be taken on board in the decisions and policies that are being made. Thanks.
And so yet another challenge was thrown, this time to young people. Give them the data, give the policymakers the data. There is Twitter on WHO, Dr. Mweti is on WHO. Tweet her today and give her your data, or give WHO after your data, and they're happy to use it. With that, I'd like to thank everyone in this room. I'd like to thank the online audience who's joined us. I'd also like to acknowledge two people who've been a big part of making this side event happen. Dr. Dovlo, who is a big champion of engaging young people, and Kevin from the WHO Afro office, who's worked behind the scenes to make this happen, because they're not always acknowledged. So with that, enjoy the cocktail, and let's continue the conversation online. Thank you.
Thank you very much, Dr. Waruguru. And indeed, let us continue the conversation when we go for the cocktail. I'll give the floor to Dr. Nyamazi, the Permanent Secretary from the Ministry of Health, who would like to make a few announcements.
Thank you very much, Paida. First, a big round of applause to the panel as they move back to their seats. Thank you so much. Again, a round of applause to Paida. I think she did a great job for an MC. I did it, I know how much it takes. So thank you so much, everyone. As well, a big round of applause to yourself. I think you've been a good attendance participant you could have today. So, I want to recall about tomorrow.